I want to bring in Deepmala Mahla, who's the Chief Humanitarian Officer for the international charity group CARE, and she joins us now from Nairobi, Kenya. Thank you so much for being here with us. So finally, after that hours-long delay, the ceasefire takes effect. So in terms of aid, what are the biggest challenges to delivering it, especially in the first few days?
Thank you very much. The biggest challenge right now is humanitarian access. So we welcome this long-awaited development, and the sense of relief felt by our teams on the ground, people in Gaza, is palpable, of course, after the few hours of anxiousness this morning. Right now, the biggest task ahead of us is a massive scale-up of humanitarian aid and commercial goods. We want all border crossings to be opened, humanitarian aid workers to be protected, so that we can save lives, alleviate suffering. And remember, not all aid comes on trucks. There is a massive issue of trauma and psychological issues. When I was in Gaza a couple of months ago, I remember meeting children. Some of them just stare blankly at one spot for hours. Some scream, are not able to sleep. And some of them have very different reactions when they see or hear bombing. Sometimes they scream and look for their moms. Sometimes they don't even bat an eyelid. So it's a big task, but humanitarians are on the ground. The trucks are ready. We are ready. We need the conditions so that we can scale up our humanitarian response. And again, we are still waiting for clarity on this ceasefire agreement. And I really hope, Kim, I really hope that this is not another fleeting moment of pause in violence, but this has to be a turning point. We must get on to building lives.
Yeah, those are heartbreaking examples that you give there of children experiencing trauma. You say you lack clarity in terms of the agreement. What exactly are you waiting for then? What do you need to know?
What we need to know and what we are waiting for, the border crossings have to be open for the aid to come in. The trucks are already lined up. And also, we need to live in reality with the fact that aid workers are protected. Hundreds of aid workers have been killed while on duty. There's no aid work without aid workers by definition. So we have the aid workers, we have the aid. What we need is conditions. And I precisely mean safety, protection, living up to the commitments, and for the ceasefire to hold.
All right. So even if those conditions are met, let's say the border crossings are opened and there is security, what about another factor here, and that's the road infrastructure, much of which has been damaged or completely destroyed? Will it be able to handle the volume of traffic, as you mentioned, that needs to be scaled up?
That's a very critical point for us. Even several months ago, it was very hard for humanitarians to reach from one place to another because of the rubble, because of the roads being destroyed. And also, we have critical shortages in fuel. So we need fuel and other amenities for the vehicles to move. And that's why I'm saying this will take time. It's not something that things can be resolved in a week or two. There has been 15 months of relentless horror. And remember, the aid workers on the ground are affected themselves. For example, I was in touch with our teams in the morning, and they were talking about going back to their places, finding the remains of their family members who perhaps died under the rubble, and then giving them a dignified burial. So there are many of these factors in play. It's not just that fighting has stopped, trucks are out, and lives will be saved. It is a beginning of an enormous task. And again, infrastructure having broken, not having the roads, and again, the weather right now, the winters in coastal Gaza mean very strong winds and heavy rainfall, and people are living in flimsy tents. So it takes time. It will need all hands on deck, and it will need the ceasefire to last. And again, humanitarians to be protected.
Yeah, and to underline the enormity of the tasks that you mentioned there, UNRWA says 4,000 aid trucks are waiting to enter Gaza. But getting all of that in, as I say, is just one step. You mentioned security, but the other day, one of the biggest challenges, according to the UN, in the last 3 months has been looting by criminal gangs. So all the aid in the world won't help if it doesn't get to those who need it most.
Absolutely. Aid workers have been witnessing, we have been facing examples where aid has been looted. And we also know of several examples where hundreds of trucks loaded with food have been standing on the border for months. And some of the aid, primarily food items, have already gone bad, waiting to be entering Gaza. And then the law and order situation. So again, this needs all hands on deck. It needs a conducive environment. But there are aid workers on the ground, and especially our Palestinian NGO partners are ready. There are plans in place. Yes, it's a huge logistics feat, but again, it's not all about logistics. It is also about giving the time, giving the space, living up to the commitments, protecting aid workers, and also civilian movement. Civilians should be allowed to move freely, because if aid cannot come in large scale, if aid workers cannot be protected, if the logistics cannot be ensured, and if the civilians are not free to move, we will be able to achieve very little in this ceasefire. And let me mention, I have spoken to some women in Gaza when I was there, and I heard horrific stories of women giving birth without assistance, some also going through cesarean section without anesthesia. Gaza is a place with the highest number of pediatric amputees in the world right now. So while we are welcoming this agreement, I cannot but help think of them, what it means to them, how fragile it is. And again, this has to be a turning point.
Yeah, you bring up a good point there, because we talk about aid as sort of this thing that is brought in, but of course there's so much medical infrastructure and so on that has been destroyed, that even if you get medical supplies in, how to get them to the people who need it, get the doctors to the patients to the doctors, all of that medical infrastructure destroyed. How is that going to be built up in the next weeks and months?
Absolutely. We have seen systematic destruction of hospitals. We have seen very systematic, deliberate obstruction of aid. And remember, the number of doctors and medical professionals that have been killed, attacked, targeted. So the health workforce is depleted in numbers, in capacity, and also in their ability. But again, humanitarians have the resolve, and they are on the ground. Our Gazan staff, with various agencies, including CARE and the UN, are extremely determined. So the scale up is very much possible. But again, as we are talking, it is going to take time. It is going to need investment, and it is also going to need funding. Right now, the Gaza humanitarian response is grossly underfunded. So we also call upon donors to invest and put in flexible funding as soon as possible, so that we can maximize this moment. And again, this morning, when I was hearing children's very excited screams and smiles, and they were talking about going back home and finding their toys and everything, let us not break their hearts one more time.
Yeah. We'll end on that note. Really appreciate hearing from you. Deepmala, Mahla, thank you so much for joining us.
Thanks for having me.